I am Jag. All right. I wanted to briefly discuss the president's recent press conference about Tylenol and autism. I woke up at 4 a.m. upset and had to stop and write my thoughts about it. I will reiterate a few of the key points I learned from this news conference. After I share, I'll give a brief rundown of the lessons I learned from that in two other videos I watched, one from an AuDHD person and one from a medical expert, so we can try to process this together as an autistic community. I wrote 4 points that were not in the conference that are my personal opinions and experiences in between the conference information. Also, advise everyone to conduct their own investigation. To create their own opinions, as these are mine. You'll understand the viewpoint that I'm giving you here today. I am a 54-year-old late diagnosed, about a year in, who didn't even suspect I had autism until 18 months ago, but I knew something was different my entire life. With a son who is 26 and possibly autistic too. So I'm speaking from some experience. When I was diagnosed with autism at age 53, it fundamentally altered my life for the better. I was finally able to put my experiences into words. I created my YouTube channel here for that same reason. Because I lack the vocabulary to adequately express the difficulties I have faced throughout my life. Well, it lessened a great deal of RSD. It greatly increased my empathy for myself, and it enabled me to organize my life so that I genuinely feel like I've accomplished a lot and am able and satisfied. Now I am very proud of being exactly who I am and how I am. I was watching a live from an autistic channel I follow right after the conference, and she said, first, I would like to point out a few things that she appreciated, that there's money being spent on studying autism. She appreciated that in this press conference they interviewed 2 mothers with 2 children, one level 1 and one level 3. So a range of experiences regarding raising autistic children in different perspectives, and she really appreciated that perspective. Here is where I disagree with her point of view. Even though I get why at the moment she felt that way, she was trying to stay positive. Point 1. Any mother who aligned herself with RFK, Trump, Dr. Oz clearly is feeling some type of guilt and has a true belief that she caused her children to have autism, since it's her true belief that autism is caused by something like food or drugs. They need the excuse, the explanation. When countless studies have proven that is not the case. Point 2. We've been here before. Dr. Asperger, for those who don't know the history, was a doctor during the Nazi regime who agreed with Nazi ideas and sent what he thought of as defective kids to the infamous AM Spiegelgrund Clinic in Vienna. The facility was part of the Nazi effort to eliminate sick children. Distinguishing between valuable and undesirable children, Asperger's research on children with autistic psychopathy in the 1930s and 40s differentiated between those he classified as promising and those regarded as untreatable. He found a smaller group of autistic boys with particular skills who he thought may be useful members of society. What he called the valuable kids, he took care of these kids and kept them safe. Asperger and his co-workers thought that other kids, especially those with more severe difficulties, were lost and didn't have Gemut, which is a German word that means disposition or temperament. He called those the undesirable children. He moved these kids to places like AM Spiegelgrund, where they would be discarded. The AM Spiegelgrund Eliminating Center, between 1940 and 1945, around 800 children lived at the AM Spiegelgrund Clinic. Many of them had mental or physical problems. The ways they eliminated them, the kids were starved to death or given too many barbiturates, which were commonly mixed with cocoa, until they perished of pneumonia or other diseases. Later, after the war ended, like many others, he tried to spin the story in their favor or in a lighter light. So, for decades, Asperger told a false story about himself as a brave opponent of the Nazi dictatorship who actively safeguarded retarded children. After the war, many people told this story over and over, which are not true. He aligned himself with them because he had the same beliefs. So we see a risk here, maybe not in the same intensity yet, of starting to quote get rid or hide end quote of autistic people in the future. Point 2. RFK Jr. Family History. because they were ashamed and worried about how they looked in public. The Kennedy family has a long history of hiding Rosemary Kennedy, who had an intellectual handicap. The family's treatment of Rosemary's condition led to a failed lobotomy and her long-term stay in an institution. This tragedy eventually inspired the family to become strong champions for individuals with disabilities. And in my opinion, which is not a medical or professional opinion, RFK Jr. should accept he is neurodivergent. Instead of feeling ashamed and trying to find a quote cure, end quote, he would be a lot happier. So here is what I took from the press conference and both videos. First, started talking about this autism study. I do just want to recognize that I would like to believe that the heart of this is providing better support to children who need it, but I don't. Okay. So, again, do your own research. I literally just watched this. I was taking some notes. As an autistic person, it does take me a while to kind of pull my complex thoughts together. So, this is my initial take, and I ask for your patience and your grace. I am a human just like everyone else. All right. So, in the conference, the president is equating, he is suggesting that there is a correlation between Tylenol and causing autism. There is also our recommendation for a drug called leucovorin. Remember the ivermectin and remdesivir treatment? Sound familiar? Point 3. Giving enough money to a scientist and/or university, eventually they'll get to the results they're getting paid to. Again, do your own research. I speak from my own experience. Here are the key details regarding this announcement extracted from Google. Based on a recent announcement, Dr. Mehmet Oz, in his role as administrator of the Centers for Medicare and Medicaid Services, CMS, has been promoting the use of the drug leucovorin for autistic people. The drug, leucovorin, is a form of folate, a B vitamin, not the kind we take with multivitamins or prenatal vitamins. It is typically used to counteract the side effects of certain chemotherapy drugs. It's a prescribed drug, not over-the-counter. The evidence, clinical trials have shown that leucovorin can help improve verbal communication in some children with autism who have a specific metabolic disorder called cerebral folate deficiency. However, medical experts and autism foundations caution that more research is needed and that it is not a cure for autism. I'll explain more later, so stay until the end. The claim, the announcement, made by Dr. Oz and other members of the Trump administration, promotes leucovorin as a treatment for symptoms related to autism. The Department of Health and Human Services, HHS, has clarified that it is not a cure and will only help a subset of children with autism. The controversy, the announcement was made alongside unsubstantiated claims by former President Donald Trump and HHS Secretary Robert F. Kennedy Jr. linking Tylenol use during pregnancy to autism. This has drawn criticism from the scientific and medical community, which maintains that there is no clear causal link between Tylenol and autism. The financial ties. Dr. Oz has been accused of potentially having a financial interest in promoting leucovorin, as his supplement company, iHerb, reportedly sells folinic acid. HHS has clarified that the drug being discussed is prescription only and should not be confused with over-the-counter supplements. One thing that the president said during this discussion is that this is an aggressive approach demanded by RFK Jr. That language is concerning to me. And it goes into kind of my main concern with these conversations. It feels like an urgency to cure something awful. So, I think there's a lot of equating autism with other co-occurring conditions that's happening. There are a lot of co-occurring conditions with some autistic people that can cause a great deal of challenges. I believe the most recent numbers show that 30 to 40% of autistic people may also have an intellectual disability, but that is separate from autism. So, President Trump, one of the things he said at the beginning was this is a horrible, horrible crisis. And then he talked about the numbers, how it went from, 1 in 20,000 to 1 in 10,000 people having autism to now being 1 in 31. Or for boys, 1 in 12, but only in California, where they have a more severe problem, as Dr. Oz shook his head in agreement. But didn't provide any evidence of this claim. That equates to autism having risen way more than 400%. Which is not true. He also said instead of attacking those who have questions, we should be grateful for those who are trying to understand a complex situation. They came to the conclusion that because they went up from 1 in 20,000 to 1 in 12, clearly it's something they are taking to. I'll talk more about that too later, what I got from the medical expert. A few months ago, RFK came up with the theory that it was food causing it, which many educated specialists proved to him was not the case. Then he tried vaccines, they also proved him wrong, so in my opinion now he is moving towards it having to be a drug then. The president said no non-vaccinated people in the US have autism. RFK had to correct him and gave an example of one study correlating the Amish, who don't vaccinate, and not having anyone with autism, which is such a flawed study, as they don't go to professional doctors and are mental health professionals, so how would they know if any of them are autistic or not? Like I said, anyone can say anything in a study to prove their points without actually showing real or coherent evidence. Also used Cuba as an example that they can't afford the drug. It's not because of embargoes that prevented Cuba from receiving medication. Saying they don't have autism, which is another lie. Not only do we not have the data about Cuba, but I'm sure they do. Probably no one told him this information anyway, but he knows if he throws words like communism, Cuba, etc., that his base will believe it because they lack the real knowledge, but it sounds right enough. Claims that autism is virtually non-existent in Cuba are false and not supported by scientific evidence. Autism is a worldwide neurodevelopmental disorder that affects people of all nationalities and ethnicities. While reported diagnosis rates in Cuba are lower than in some developed nations, experts believe the difference reflects challenges in diagnosis and limited resources rather than a true lower prevalence. By the way, this is Googleable information. Point 4 Correlation doesn't equal causation. So let's break it down from what I heard on the conference and from the medical professional. Sorry if my thoughts are all over the place, as this is not only quite recent information but also quite confusing. She started with, quote, one could not even count the number of falsehoods that both Trump and RFK were saying. It was a fire hose of rumors. Just not based in evidence. End quote. It was a word salad, right? The president started with, this is the most alarming rise in the public health history of any public health problem, and you know there has been a rise in autism. Research has shown a lot of factors and what's contributing to the rise. One of it, the most dramatic causes of the rise. It's just that the way we diagnose autism has changed. It just got better. We are better at testing. We are better at understanding, better at diagnosing, better with knowledge and technology, better at communicating, and better at seeking diagnosis. Just like many other things. We can now diagnose and treat cancer better, isn't that right? And then they go on to say that they think it's Tylenol that is causing the rise in autism as well as folate deficiency. That there should be this new cure. Basically, they were saying that a pregnant woman should never take Tylenol. I just want to kind of unpack it so people who didn't watch the news conference know. They said that women should not be taking Tylenol, which puts women in a very tough predicament because, especially during pregnancy, there are no other alternatives to Tylenol. You know, usually with RFK there's usually a kernel of truth that is just mixed in a ton of falsehoods. And it seems like the president is following suit. What the latest numbers we have are, I think it's 1 in 300 people or children in the United States who have autism. There were so many falsehoods in this press conference. It was like a fire hose of falsehoods. Some of the ones that stuck out to me in another expert video I watched were that there's definitely this causal link between autism and Tylenol, and that's just not the case. The reason why they're saying this is that the Trump and RFK claims are really around this Harvard Mount Sinai study, and it was a review of 46 studies, but even in that study they did not find any really big link between the two. The authors in that study flat out said they cannot determine causation, right? Correlation does not equal causation, and coming to that conclusion can be really quite dangerous. I think that it's very clear in 2024 we got this really nice study from Sweden which looked at the link between Tylenol and autism, and what they found was that when they compared siblings, one exposed to Tylenol when in utero and the other not, the link between Tylenol and autism completely went away, and that's Because they were able to control for other factors like genetics and family environment, which all the other studies were not able to do. And so this 2024 study in her mind really put to rest this question of whether Tylenol is causing autism. That was never mentioned in this presser. She mentioned also she has not seen a study that shows causation compared to correlation other than the Swedish study that refuted the link between the two. And that nuance is really important in science, right? That it's really hard to measure the real world in scientific studies. And so what we usually do is build on evidence study after study to create an understanding of what this picture is. And today that picture doesn't seem to create a link. She also mentioned the biggest falsehood that, came to mind. The other really concerning thing was what Trump said, that, there's no downside in not taking Tylenol when you're pregnant, and that's just not the case. I mean, if you have a high fever and you're pregnant, that can activate the autism gene, right? So, there are actually real benefits to taking Tylenol and protecting children in utero, and thinking that blaming mothers and women for this is really quite dangerous as well. So we can't just take the precautionary principle and say no one should have Tylenol. Are there other painkillers or pain relief medications that are considered safer for women to take than Tylenol? No, that's your only option. So, they're basically taking away the only option that pregnant women have. That's just not acceptable either, especially when the science is not evidence-based. RFK mentioned the folate acid component of this too. They basically stated that a lack of folate or a lack of folate in a developing fetus's brain could also result in autism. I know that prenatal vitamins have often included folic acid since 1990. I remember taking them myself when I was pregnant with my son. Then shouldn't the numbers have gone down, not up, right? Okay, the role of folate and if that could be somehow, as the administration is claiming, or lack thereof responsible for autism. I mean, it's very clear that folic acid, or folate, is super important during pregnancy. Large studies had shown folic acid as really important in preventing serious conditions like neural tube defects. There have been a few small studies that have explored whether this may shape development differently, but again the evidence is just not consistent with autism in particular. The case RFK is trying to make, and in her honest opinion, is really confusing because she is having a hard time following their logic. It is that if they're claiming that if you take Tylenol, it decreases the amount of folate, then what causes autism scientifically didn't show. Let's talk about it. Leucovorin, a subtype of folate, is not a supplement. It is a prescription usually used in cancer treatment. She mentioned there's this rare condition called a cerebral folate deficiency. And that's where folate in the blood looks normal, but the brain doesn't get enough folate. There actually have been very small studies they've seen among children who are both autistic and have this condition that there are benefits to leucovorin. Because of these very small trials, the challenge is improved communication as well as improved behavior. But much more research is needed, because it can be just coincidences. These are really small studies. Also, we're talking about a very rare disease. I think implying that anyone telling you to run out and buy is irresponsible because this is grossly overestimating the evidence that we have right now. And basically I thought my understanding was what they were saying is they want doctors to start treating children with autism with leucovorin right now. So basically they are using children as lab rats, where there is no real evidence for it. Dr. Oz, as a real doctor, should have the moral responsibility to point out how dangerous this is. That may be at risk for autism or behavioral changes. Another point she said was because there are conflicts of interest here, too. So, is this the cure for autism? Also, let's follow the money and see actually who owns patents in this folic acid, folinic acid, and other supplements. There are a number of wellness people out there that sell these supplements as well and provide a lot of prescriptions that are only interested in financial gain, like I mentioned about Dr. Oz. They were really trashing science and trashing the NIH and basically saying they were looking at the wrong things. Butchering, actually. RFK Jr. was talking about how scientists have looked for the genetic reasons for autism, which is wrong. There are many serious, long studies that prove the link between genetics and neurodivergence. That they should be looking at something else. All I kept thinking when I was watching this was, oh great, another reason to dismiss and disrespect and defund real scientists. Another reason to dismiss autistic people, neurodivergent, period. Yeah. I mean, that's the case that they're trying to build right now. I would be surprised if in the near future we see cuts to autism support. But we have so many studies from really brilliant scientific groups around the nation at Yale and at Harvard that have been studying these links for a very long time, and to assume otherwise, I think, is very risky, and it's just not reflective of the reality on the ground. One of the announcements today was that they're going to provide more funding for research, which should be beneficial in theory, but it also can be detrimental, as I point out in point number 3. They choose to only give funds for the results you want to get. I think it said $50 million extra. Imagine throwing $50 million to be used to segregate, push us back into the 1700s, and ignore the evolution of research and knowledge. A lot of research has already gone into this, showing the total opposite of what they want to believe. It's a really challenging thing to study in public health that a lot of health outcomes, if not all of them, are a combination of your environment and the genetics. And being able to separate those two apart is really hard. I also think here, a really important message is that, the president opened this presser saying that this is a horrible, horrible crisis. But I really want to hone in on the fact that autism is also not something that needs to be cured. It is a very natural part of human diversity, and people with autism deserve understanding. They deserve respect. They deserve inclusion, and they deserve the support they need and want. It is very unclear to me that I would, very doubtful that the autism community is behind this, and this is what they think is needed for the future. I think we really need to be listening to them to help drive research and determine where it should be done. She was asked, what about the vaccine scheduling? The president started talking about hepatitis B vaccine that should be given to kids when they're 12 years old. He was talking about other vaccines too. He started talking before the moms who believe vaccines cause their children to have to develop autism. RFK has been saying for the past 20 years. So, I guess I'm not surprised. He is insisting on this. There are a few things that they claimed. One is the number of vaccines. So, the president said, our kids get 80+ vaccines, which is incorrect, by the way. That number is not that high. They claimed that the MMR vaccine, which is a combination vaccine for measles, mumps, and rubella, should be separated and not given together. There's absolutely no evidence to show that the combination vaccine leads to more autism. They did bring up Hep B and said that it should be given at a later time or not given at all. The recommendation should be given to a 12-year-old instead of as a baby, when puberty starts, and maybe babies don't need to get it. So the highest risk that you can be exposed for Hep B is the first 2 or 3 years of life. Getting it at 12 years, you completely miss the risk window of hepatitis B infection and chronic disease. So getting it at 12 years won't help. So one high-risk condition for getting Hep B is that the mom has a history of 4 drugs or has multiple partners. The challenge is that's not all cases. In fact, only about 50% of cases are linked to that at birth, which means you lose 50% of other cases, and so, it's really important, and this is why we have a universal Hep B vaccination at birth, so it's a safety net. I also believe it is an optional vaccine, so the parent can choose not to give it to their children. You catch all of the cases starting at birth. I will not be surprised if they take on Hep B policy meeting over at CDC next month. This has been a low-hanging fruit for them for a long time and unfortunately will impact the most vulnerable, but also has an impact on other children out there as well. I think one of the most concerning things that I have is that we continue to blame moms and give unfounded guilt around things that they do during pregnancy. And I think that is one of the most dangerous things that could come out of here. There are many moms out there that feel a lot of guilt around their kids with autism. Some don't, but I think that taking away those tools and blaming it on something when they really want and deserve answers is not the right route. The only guilt I have was not realizing earlier I had it, and he also does too, so we both could have gotten the support and understanding we needed. But clearly, those two moms they used in the conference felt guilt and possibly even shame or stigma. Yeah, that is what I got from the word salads that they were saying. It sounds like they're wanting to do a safety label change on Tylenol to warn about this risk, which will cause more doubt about using Tylenol when you really need it. I don't use Tylenol because it causes damage to my stomach lining. But I don't think any mom takes any drugs without being careful when they're pregnant. This unfounded, fear-based lie can bring risk with pregnancy. Dr. Leo Kanner was the first to describe a child in his groundbreaking paper on early infantile autism. Kanner observed symptoms in this child as early as 1938. But his official publication in 1943 marks the recognized starting point for autism as a distinct developmental disorder. Acetaminophen did not become a widespread medication until 1950. Tylenol, the brand for acetaminophen, was not introduced until 1955. It is so important that high fevers in pregnant women are precisely what could be turning on the autism gene. Some studies have shown that a high fever during pregnancy can cause developmental challenges like autism. The second thing I heard them say was that they want providers to prescribe lower doses of Tylenol during pregnancy when necessary, although I didn't understand this request. Tylenol is not necessarily always prescribed, though, so I didn't understand that policy change. The third policy I heard was an increase in research at the NIH towards autism, which, okay, can be great. I'm all for giving more research. But I think that the underlying assumption was that it wasn't happening before, and that's just not the case. And how the money will be used to achieve their agenda. If the money will be given freely or only as proof in favor of their uneducated, unsubstantiated point of view. Or worse, use the money to harass, intimidate, or punish the researchers and medical professionals. Even creating new laws to intimidate all of us. And I guess what I thought was confusing, it sounded to me, and again, it was sort of hard to keep up with everything they were saying and to try to make sense of it. There is something that can help with autism now, and that is leucovorin, and that they were going to talk to doctors about using this more is what I heard. You know, I really want to see this report that comes out to, actually understand what their policy points were. It was really hard to understand with the word salad. But yeah, that is one thing I will tell you. One of the worst things that could happen is also a run on the supply. We saw this with ivermectin, right? People need this medication for other things like cancer. And if there's a run on the supply because of a lot of worry and a lot of unfounded claims coming straight from the highest level of health, that's a really big problem and certainly can be a ripple effect from this announcement. The president said they pump so much stuff into those beautiful little babies, it's a disgrace. It looks like they're pumping into a horse. You have a little child, and they pump in a blend of over 80 vaccines. That is an incorrect number. I know you are wondering, how many vaccines do children get in general? It depends on what you count as childhood vaccinations. I think by the age that you are 2, it's around 25 doses. Not different vaccines. These are different doses. As you age, I think by the time you're 18, it's around 60 if you include flu and COVID every year as well. So deduct 36 from that, 2 a year if you don't take COVID and flu, which I never give my son the flu shot. So a total of 28. It's a massive reduction from 80. Our immune system actually sees thousands and thousands and thousands of microbes and bacteria and viruses every single day. And our immune systems do a really good job at still protecting us. There are really a number of the tested vaccines, like MMR and chickenpox, that have been tested for over 50 years that are not harmful on the schedule right now. When it comes to the flu, COVID, HPV, make your own decision based on your own research. They're just like throwing in the whole kitchen sink with all of this to see what sticks. And I think that's part of the strategy, a lot of confusion, a lot of chaos, hoping that some talking points stick and people take it and run. I think it sowed a lot of confusion among the general public and among pregnant moms. I hope that pediatricians are looking to their professional organizations and looking to the autism community for their signals on what we should be doing in this moment. I think right now pediatricians should also approach questions from a place of empathy. There's going to be a lot of questions from parents. There's going to be a lot of confusion. And in this moment, we cannot dismiss that confusion and call it disinformation, and we really need to meet people where they're at and take the time to answer questions right now. I think that's the best thing we can be doing. And I would imagine the American Academy of Pediatrics is going to have a lot to say about this, I hope. As for now, they've been on top of it. We're living in such a bizarre time, aren't we? It's exhausting. Trying to separate truth from fiction. And I'll just say, as a mom too, this is all confusing. I couldn't imagine what all of my friends are going through, or my neurodivergent community, or fellow moms out there. I guess my biggest piece of advice for moms is look to American Academy of Pediatrics. They have a very clear, consistent evidence-based approach, and I have not lost faith in them yet. In fact, I think I have more faith in them in this moment. Unfortunately, we are getting to the point where we cannot trust our federal government at the same stature, and gaps need to be filled elsewhere. We don't have, a functional CDC, for example. So, that's another place that you really can't necessarily trust for information and guidance. Of course, ACOG is the American College of Obstetricians and Gynecologists. Again, the American Academy of Pediatrics is another reliable source for now. But as we can see with the silencing and prosecution of the medical and scientific community, always do your own research too. We don't know how long we'll be able to trust them. I mean, we're talking right after this whole dump of information that was really hard to understand and really hard to validate. And so as more information becomes available and they potentially cite studies that they're claiming prove one thing or another, I'd love to continue talking about this as a resource for everyone. And we really need reliable, accurate medical information in this current environment now more than ever, at a time that science is not only being trashed but also defunded, which is one of my many big pet peeves about what's going on in our country right now. Anyway, I have indigestion after that. Sorry that was a very long videos. But I was quite upset and frustrated. Thanks for those who had the patience to stay until the end. Please give it a big thumbs up. And let me know in the comments below your thoughts. Don't forget to hit that subscribe button and turn on the notification bell so you never miss an upload. Your support means the world to me and helps me grow. Sorry if this one quite messy, that's how I feel right now. Keep resisting. See you next time.